you've tried all different kinds of medicines for it, haven't you?
I've had Robitussin, I've had a medicine that the pharmacist made up for me, I had a medicine that a homeopathy made up for me. I went on the internet looking at what I could take, what I could do. I've tried everything to try and stop coughing. Sometimes I only need to swallow and I get a tickle in my throat, and I try not to cough, and I think, you know, and then I just cough and cough and cough. When I first get out of bed in the morning, that can set me off. And sometimes when I can just start to drink a cup of tea.
Yeah.
And I'm coughing, that sets me off. Whether it's the fumes from the tea or whatever it is, makes me cough.
Right. You want to know what it is? When the tea hits the back of the throat, it sends a reflex down and opens the valve up. So reflux comes up.
Somebody mentioned something about a valve here.
It's called the pharyngeal lower esophageal sphincter reflex. So going back to the cough that you get when you get out of bed, do you wake up all right?
Yes, I wake up fine, apart from I've always got a headache, but that's me anyway.
Yeah. So you wake up fine. Have you ever tried just lying there and not moving?
No, not really. No.
So I bet you don't cough. So you try that as a little experiment.
Yeah.
It's when you get out of bed.
Yeah.
Right? Because the movement of getting out of the bed opens the valve.
Right.
So let the gas that's been trapped in the stomach overnight out. And so you start coughing.
Start coughing.
Do you get a feeling up here?
Yes.
Tell me what that's.
Yeah. Sometimes I feel as if I've got something in my throat, and it's weird sometimes, you know, and that sets me off coughing as well. So.
Does your voice go funny with it?
A little bit croaky. But then I find when I've finished coughing, I'm okay again. The doctor said something about this here. He said that you could need an operation or something for it. Am I right?
Well, we usually try the tablets first, right? So the tablets, there's 5 or 6 different tablets that we can try. Right. And so we usually recommend them to the doctor and let the doctor help you with them.
Yeah.
Right? And if they don't work, then it's time to consider the operation.
Right.
And before that, we would have to do a test, which we have a tube down, not to look at the things, but to measure the pressures. It's called manometry. And we have a special one called high resolution manometry, and we can see most people like you have abnormal movement in their gullets, or a weak valve, or sometimes both. So that's the cause of it.
Yeah.
The gullet isn't working very well, or the valve in between the gullet and the stomach isn't working very well. So the tablets that we give, 9 out of 10 people get better with some of them. Right? And the 1 out of 10 that don't get better, those are the people that need the operation.
2 years it's gone on.
Oh, that's below average.
Is it?
The average length of time someone's had a cough who comes here is 6 years.
Really?
Yeah.
Oof.
Our record is 66 years. And we made it better.
Poor thing.
And we made it better.
That's amazing.
Yeah.